You would agree with me that we don't use a fire hose to water a potted plant because it's going to wilt. We don't use a flame torch to light a candle. It'll melt. We don't use a sledgehammer to crack a nut. It's going to be blown to smithereens. When India's geographical neighbor to the west talks of using the nuclear option to sort out minor disagreements, he loses his strategic deterrence. So this is the law of nature. You don't use maximum force to solve any problem. And so it applies to use of DHT blockers in the treatment of hair loss. The hormonal milieu in the body is precipitously balanced. If we seek to upset it disproportionately, we have a price to pay. And this is covered very succinctly in these two videos in this playlist, where I discuss the severe side effects of using DHT blockers disproportionately to the problem and what are the consequences that may result. So as we all know, Finasteride, that is Propecia or Proscar, is a DHT blocker which inhibits the conversion of testosterone into DHT by inhibiting 5-alpha reductase. And similar is the action of the more potent DHT blocker, Dutasteride. The only difference is that whereas Finasteride selectively blocks type 2 alpha reductase, Dutasteride blocks both the isoenzymes type 1 as well as type 2 5-alpha reductase. And in so doing, Dutasteride blocks up to 95% DHT, whereas Finasteride blocks only about 73%. The blockage of type 1 5-alpha reductase isoenzyme is 3 times more for Dutasteride as compared to Finasteride. On the other hand, the blockage of type 2 isoenzyme of 5-alpha reductase through Dutasteride is 100 times more. So Dutasteride is disproportionately more effective as compared to Finasteride in the conversion of testosterone to its active metabolite DHT. And when we are using Dutasteride without giving it much thought, we are trading its efficacy for greater side effects. Yes, I use Dutasteride in the treatment of hair loss along with Finasteride, but I use it with due diligence, due thought, after analyzing a whole lot of factors so that we do not get into a problem. The effectivity of Finasteride is very well established. It is the only DHT blocker which is US FDA approved for the treatment of hair loss. Dutasteride is not yet approved for treatment of hair loss by the US FDA. However, it is approved by the Japanese and South Korean medical authorities. Since we've been using Finasteride in the treatment of hair loss for over 30 years, and it has been approved by the US FDA since 1997, we have a long experience for treatment of male pattern baldness. We know its efficacy profile. We know the type of side effects it causes. The drug profile of Finasteride is very well known to us. This does not hold true for Dutasteride, which is a relatively recent drug. Dutasteride is not FDA approved. Dutasteride, when we use for hair loss treatment, is an off-label use. This we have to keep in mind when we use Dutasteride because it has certain medico-legal implications as well. In a study by the American Academy of Dermatologists, 516 men were evaluated through a double-blind trial, the effect of Finasteride on hair loss and the effect of Dutasteride on hair loss. And it was found that those on Dutasteride experienced greater target area density, a greater hair count than those who were treated with Finasteride. So what are the instances in which we use Dutasteride? What are the instances in which we use Finasteride? And what are the instances in which we use a combination of these two drugs, supercharging the effect of Finasteride? We'll be discussing in a moment. Hold on. In my many years of practice treating hair loss, doing hair transplants, I have found that there is no drug that rivals even closely the use of oral Finasteride in maintaining your hair, in preventing future progression of baldness, in bettering results of hair transplant. But there are many patients who develop over a period of time tolerance to the effects of Finasteride. It could be because of many reasons. People who have not been taking the medicines in the way it should be taken, people who have not been giving breaks in between, who have been taking the medicine continuously and the body has readjusted itself to the use of Finasteride, and the DHT receptors on the follicles do not respond to it anymore. In patients who are young and in whom hair loss is very rampant, it's like a field fire where it becomes an emergency to treat the hair loss by whatever means we have at our disposal. So in these cases, I may use Dutasteride for the initial first 4 to 6 months till such time the hair loss is stabilized, and then continue Finasteride at an optimal dosage customized to the patient's requirements. And then there are certain situations in which there is a lot of stress. There could be illness in which there is a sudden increase in hair loss where we may like to expose the patient to once a week Dutasteride. I have also used Dutasteride intermittently in patients for for a better response. Every 3 months or 6 months, exposing the patient for about 2 to 3 months on Dutasteride besides Finasteride. Now, when I use Dutasteride, my most common regime is to use Finasteride 1 milligram or Finasteride half a milligram every day for 6 days in a week, that is Sunday to Friday. On Saturdays, I use 0.5 milligram tablet Dutasteride in place of Finasteride for that day. This works well for me. Finasteride has a half-life of 6 to 8 hours. Dutasteride has a half-life about 4 weeks. And even when you're taking lower doses of Finasteride, you have an umbrella, the cover of an umbrella, so you can benefit much more by taking lower customized doses of Finasteride than you otherwise would. So the bottom line of today's talk is that both the medicines Finasteride and Dutasteride complement each other. Supercharging Finasteride with Dutasteride in some patients has a lot of positive effects, better control of hair loss, better control of progression, and lesser side effects when we expose the patient to Dutasteride while decreasing the dose of Finasteride. So that is the talk for the day. A very commonly asked question, whether one should start Dutasteride or not along with Finasteride. So I thought I'll cover this. If you have any other question about hair loss medication for men or women, about hair transplants, I'm there to help. Please drop a comment in the comment section below and I'll get back to you. If you want an assessment for your hair loss, send your pictures to the WhatsApp number mentioned here. And if you want to research Finasteride more, this playlist out here has a whole lot of videos which will take you through everything you need to know about Finasteride or Dutasteride. So thank you for watching and God bless you.